I'm Dr. Ian Binnian. I'm a GP partner in surgery in West Oxfordshire.
I'm Dr. Nick Thomas. I'm a GP in Windrush Medical Practice in Witney, West Oxfordshire.
These are the 9 things that we learned in running our vaccine trial.
Janssen approached the NIHR, and locally within Thames Valley, the NIHR Thames Valley decided that it might be best to run it within primary care. It's been an amazing success. We've had participants travelling from all over Thames Valley to be part of this, giving up their time, amazing volunteers to participate, and absolutely amazing staff who've come from all over as well, from secondary care, from different hospitals, to really help to run this and deliver this trial. Our original targets were 333. We actually recruited 478 participants. The trial is still going on now. Amazing to see that the Janssen vaccine then got licensed. Absolutely superb to see that in America first and then across the world. And so to take part in that and be part of such a groundbreaking vaccine to really help everybody is an amazing opportunity. 1. Get help. This is a vaccine trial. You need the real expertise to be part of this. That expertise comes from all different parts of the NIHR, and that's why it's important to be engaged with the NIHR and have their support. We've had expertise coming from secondary care, from the vaccine centre, but also from experienced research nurses and staff who've come from all different disciplines and specialties to really support this and come together. That is an essential part of running a trial of this size and scale. Really important to do that also with the administrative support and the backing of the NIHR, who has expertise in running big trials at scale, at speed. And that's really key to this.
2. Map out the patient journey. We needed to map out really what the screening and recruitment visit was going to involve for the participant. This involved obviously going through the whole consent form, so having a rough idea of how much time the consenting process was going to take. The screening procedures, obviously there's a few physical checks and things to be done, and then around the actual randomisation and having sort of prior knowledge and be able to run on the dummy site through a sort of randomisation.
3. Run a pilot. Doing that patient journey, getting that really streamlined is really key. The only way to do that is to test it out. And by running a pilot where normally you'd be thinking and planning to maybe doing 10 to 20 participants a day, that kind of level. Initially on the first few days, you may be doing 2 to 6 participants in the first few days to really look at what happened, making sure that every member of the team is aware of what their role is, what they should be doing, making sure that we made sure we abide by everything within the protocol and followed everything meticulously to leave no stone unturned. Iron out any teething problems, whether it's just administrative issues with the computers, as it always is. There's always something wrong with the computers as time goes on, and so you think to yourself, actually, let's get these systems right, and then our clinics could build after that.
4. Listen to feedback. General feedback was very positive, and it was good to hear good experiences from participants. The negative feedback, it's always around the technology, and is the technology going to work, and does that interfere with the timing? We did end up changing timings on a number of occasions for our clinic visits. We were able to feed back to the sponsor and around obviously the issues we'd been having with the technology and the app, and that definitely has improved, and they made a number of changes over the first few months.
5. Give yourself time. It's always quite easy. You look at a protocol and a trial, you think, oh, we can run that should be all right. And you put some timings together, you think that'll be great. But there's a lot of hidden timings in there where you think, oh gosh, I've got that maybe wrong, need to have a look at that again. Things always take longer than expected. So that's why you always give yourself time to plan. Planning is really key. So the night before you have a look at what you're going to do, and even spend a couple of days in beforehand to have a look at the clinic, making sure that it's tight, making sure all the paperwork is in place, making sure that the systems are ready, making sure that that participant is ready and they've got the consent forms, they've had a good look at them, some of their questions have already been answered perhaps. All those things are really important when you run it. And also those things will change through the day as well. So you make sure then for the next clinic, you make those changes and you also review what you're going to do again, and reviewing those systems is really important. Things do take longer, so therefore staffing is really important. If you're balancing that, add a bit of extra time at the end of a clinic, add a bit of extra time at the start of a clinic, making sure your participant doesn't come in at the same time as staff starting. Staff should have a good time to bed down, get ready and prepare, ready for that session to start.
6, accept you can't plan for everything. Anything could happen at any time, and it's always best to be calm, collected, not panic, keep an open mind, share with colleagues, get advice from colleagues. One of the common ones might be around our laboratory dry ice work, and expecting deliveries from delivery companies of the dry ice, and then that might not happen. Multiple consenting because of various amendments through the trial. There's been a lot of reconsenting to be done, and it's just really important to put time aside for that. I think it's very important to keep an open mind, and we've learnt huge amounts through such a large trial over such a long period now, that there's been many changes, and at each stage we've learnt something new and have learnt to adapt.
7, hold daily reviews. A terminology that I wasn't really aware of before was the huddle, the daily huddle. We used to have a daily huddle. Sometimes we'd have 2 in a day, which was amazing. A pre-clinic huddle and a post-clinic huddle. The end of the day was really important, especially in the first couple of weeks of the trial, where we'd meet up, and this is the core team. It wouldn't be everybody. It would be learning points from today, what happened at different time points, what were the key problems, what can we deal with those tomorrow basically, and what needs to be dealt with now. So a lot of those were around timings mainly. Was around how did the clinic run, where were the teething problems, how making sure that participant journey is really streamlined and comfortable for the participant. And so what you're trying to do then is making sure that you build an extra time, which is what we had to do with a few of the clinics, and we sort of change our timings around when the participants would come in. That's really important to do that. And looking at the process of how the vaccine was being produced and how it was being made at the time and being drawn up, and was there enough time built in for that.
8, communication is everything. Communication with the participants, if you don't keep them happy, then they lose faith with you, and it's absolutely essential to let them know, where they are at in the trial, what the commitments are. So they always had a phone call plus the email around their actual clinic visit. For those who had to go through the symptom clinic because they got COVID or COVID-like symptoms, I would always text them the night before, just as a reminder with the time. It's really important to think through what a trial participant's experiencing and what their involvement is, and what a huge commitment it is for them as well.
9, remember you're dealing with people. You can get really caught up in the protocol and caught up with the system and the process and what's going to happen. In amongst all that, there's a participant, there's a patient there who's come in and given up their really important time. They've come up and they felt they want to be part of this, they felt strongly that they want to do it, and so they've come in, and sometimes that gets lost. And it's really important that you don't do that. That's why that's why I'm a GP. I really care for my patients, and it's the same in this scenario. You really got to think and have a pragmatic approach to some of this, and really look at it and go, actually, they've given up their time. It's really important that you support them doing that, keeping them up to date. Communication is really important, and maintaining that relationship with the trial is really important to sort of retaining them on the trial for the future as well.